Dr. Meyer, here's the toucan.
Jason, I didn't say toucan. I said you can.
Oh.
Hi, Ward the Airlink ventilator guy here again. Get her tubed. Get her ventilated. This is a You Can Toucan presentation by Airlink at Regional West. Last time we talked about initial ventilator settings. FiO2 at 100%, a PEEP of 5, a respiratory rate of 12, and a tidal volume of 8 cc's per kilo. Today we're going to talk about oxygenation and ventilation. When we're talking about oxygenation, we're talking about the PaO2 on the blood gases or the oxygen saturation on the pulse oximetry. So if a patient is hypoxic, we can do two things. We can increase the FiO2 or we can increase the PEEP. Initially, we had the FiO2 set at 100%, and you can't get any higher than that. Initially, we had the PEEP set at 5. Well, if the patient is still hypoxic, we can increase the PEEP to 8 centimeters of water pressure. If the patient's still hypoxic, we can increase the PEEP to 10 centimeters of water pressure. You probably need to wait 20 to 30 minutes in between changes of the PEEP, and hopefully you'll get some kind of alveolar recruitment. Now the problem is with PEEP is we're increasing interthoracic pressure. Increasing interthoracic pressure will reduce venous return to the right side of the heart and may be causing decrease in blood pressure. Now Toucan is quite the philosopher. He was talking about his cousin, the eagle. He was saying, eagles fly high in the sky, but weasels never have to worry about getting sucked into a jet engine. Now that's funny right there, I don't care who you are. Now we're going to talk about ventilation. When we're talking about ventilation, we're talking about the PaCO2 or the end-tidal CO2. So if you have high levels of carbon dioxide, we need to increase the alveolar minute ventilation. So we can increase the tidal volume or we can increase the respiratory rate. Initially we had the tidal volume set at 8 cc's per kilo. If you're happy with that, you're getting good chest excursion and your peak inspiratory pressures are less than 30, then you probably should change your respiratory rate. Initially we had it set at 12. Well, if you still have high levels of carbon dioxide, turn it to 14. Still having high levels of carbon dioxide, turn it to 16. To review, if we're having an oxygenation problem, we can increase the FiO2 or increase the PEEP. If we're having a ventilation problem, we can increase the tidal volume or increase the respiratory rate. Just remember, the early bird catches the worm, but the second mouse gets the cheese. For you intellectual people out there, see, the first mouse is dead in the trap. This has been a You Can Toucan presentation by Airlink at Regional West.